of a 33-year-old patient who had over 12 cc of hyaluronic acid filler injected to her face.
What is filler face? Okay, so we all know that filler is a product that's used to add volume to the face. How does it do it? Filler has hyaluronic acid, which is a hydrophilic component. This is basically a product that sucks water into it. And what you're seeing in this video that my colleague has posted is that over time, filler can actually spread throughout the face and can accumulate water in high volumes. This patient that you see only had about 12 cc's of filler injected into their face, but the video shows a volumetric analysis of around 28 cc's. So what's happened to take the amount that we injected and more than double what's there? Over time, the hyaluronic acid has drawn in more water. It's done its job to hydrate the face, but this is far too much volume to add to most faces. When I do a facelift and I put fat into your face, it's usually somewhere between 10 and 20 total cc's, and this is for patients who need volume, who've lost volume, who are getting a facelift. So someone who's in their 20s and 30s who only needs a small amount of volume in the lips or in the cheek or maybe in the temple, to use this much volume is unconscionable. It's too much, it overwhelms the face. Furthermore, the filler that you see, which starts off as a long-chain hyaluronic acid, is slowly degraded by the body over time. And when the body breaks the long-chain hyaluronic acid down, it creates small-chain hyaluronic acid. Hyaluronic acid, which is smaller than 20 kilodaltons. This small-chain hyaluronic acid may be pro-inflammatory. It may cause inflammation in the tissues and may cause other bad effects. Plus, it can go to the lymphatics, the small vessels in the face that are beneath the skin, and it can travel to lymph nodes, causing swelling, causing blockage in the lymphatics, causing swelling in your face over time that's not related to filler in that area. So even after you dissolve the filler that's there and it's gone from this region, it can move to the lymphatic drainage places, it can move to the lymph nodes, and that can block the drainage of fluid from these areas. So you can still see lymphatic fluid swelling in these areas even though there's no filler left. Although filler is a great product and it's optimized in certain areas for certain tissues, you have to be careful about how much you're injecting over time. And forget the fact that everyone tells you you need it again in 3 to 6 months. That's ridiculous, because as you can see in patients like this, over time it accumulates, it adds volume, it moves, it migrates throughout the face. Why is fat better than filler in most patients? Because if I take a fat cell and I put it into your face, it needs oxygen, nutrient, blood supply. It becomes rooted in that area. Like a seed in soil, it grows roots and it does not move. Hyaluronic acid is very small and it can move throughout the tissues, and those breakdown products can move anywhere in the face, as you can see here in these MRIs where it shows that the filler has moved throughout the face. Long story short, most important concepts here: filler swells, it adds volume, and breakdown products of filler may not be good in your face or in your lymphatics over time. Fat is probably a better option. And I'm not against filler by any means, but I do think that we have to be careful and cautious with where we inject, how much we inject, and over what period of time we're doing it. And it's probably a good idea to see a plastic surgeon at some point and have a consultation about using fat when you've become fatigued from all of this filler fatigue.